Hypoglycemia is a problem for people with diabetes. And hypoglycemia causes not just a physiological response, and by that I mean it doesn't just increase your heart rate or make you sweat. It causes lots of effects on mood, such as anger, and on a condition we call tense tiredness, where you are both tense because of the high adrenaline levels, but also tired because of the low sugar in the brain and the mind. And that's a very unpleasant sensation. And when it's very severe, some people lose consciousness.
It's terrifying at times. It's paralysing, it's scary, it's a pain. It's the most difficult thing ever because I can't play with my kid or I can't finish doing the tasks that I'm doing.
I've spent my working life designing experiments, but after nearly 30 years, hypoglycemia is still a major problem, and we've virtually just scratched the surface.
The aim of this project is to try and define precisely what degree of hypoglycemia carries those sorts of risks. Risks to the health, risks to happiness, risk to the patient, risk to the people around them.
Hypoglycemia can be very severe and can have extremely dangerous consequences, including coma and death. But equally importantly, the not so severe hypoglycemia can be very dangerous both in the short and in the long term. So it is a huge problem for people living with type 1 diabetes and type 2 diabetes.
For me, as a person with diabetes, I'm scared of having a hypo. My girlfriend even more. More research into why hypos are happening, what is the consequences of a hypoglycemia, etc. will hopefully in the long run help us to be better at not only understanding them, but also to prevent them.
My daughter is 13 years old. When she was newborn and little and I was breastfeeding her, I used to breastfeed on the floor because if I did go low and dropped her, it wouldn't be too far for her to fall. I was worried that I was going to put my child at harm, and if my husband wasn't home and it was just me, that something might happen and she would be left alone while I was trying to deal with that.
It will show to society that, and in many ways this is part of the Innovative Medicines Initiative, that industry and academia and patient care organizations can collaborate together to produce the sort of trials that change the landscape and change the way that we practice medicine. So I think that is a very important message.
Maybe the training that I would have received 20 years ago would have been different on that part. So I probably would still be able to drive. I wouldn't have had epilepsy. I wouldn't have had severe seizures and cramps and hypos, because I was more aware of why hypos are dangerous, even if there's no symptoms.
It's going to be definitely helpful for the patient to have a better life. That's it.
If HypoRESOLVE can lead to a mindset shift in the education of patients about hypos, that'll be a huge benefit.